Hello, I am Dr. Bishash. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I'm Nicola Keats, 33 years.
Okay, nice to meet you. How can I address you?
Nice to meet you, doctor. You can address me as Nicola.
Okay, Miss Nicola, I have got a letter from your GP saying that you have rash on your body. Is it right?
Yes, doctor, yes.
Okay. I am going to talk about your health issue, and all the information during our discussion will be remain confidential. So is that okay for you?
Yes, doctor.
So can you please tell me in your own words what is happening with you?
Well, actually, doctor, the problem started actually around 3 days back. 3 days back, I noticed that I had some rashes, okay, in my hands. At the beginning, I didn't uh, actually notice that I actually uh, didn't count it that much. But yesterday, I noticed that actually now my arms and legs and even my trunks are also getting involved. My tummy. Okay, there are some rashes in those places as well. And so I went to my GP. My GP did some blood tests, and he told that I had some problems in the blood. I don't know about it in details, and for that reason, I have come to you.
Okay, I'm sorry to hear that. And you said that it started on your hand.
Yes.
Okay. And can you describe about your rash more? Do you have any pain on it?
No, doctor, I don't have that any pain. Actually, these spots are very flat. Okay, doctor. There have been some flat spots. Some of them are very small, and I actually, out of interest, I just gave some pressure, and I noticed that they don't go away. These rashes. Uh, that's what I have thought. I saw. That's how much I can help you.
Okay. Is there any
And
variation
actually, there are
in size?
blue reddish. I think around reddish this color.
Reddish. And is there any variation in size?
Doctor, I think that there some are quite small. All are not in the of the same size. Some are very small, very tiny.
Okay. And any itching? Do you have any itching?
No,
Have you noticed any color change? You said that it's reddish, but any color change?
no, doctor. I have noticed.
Any skin change over the area?
No, doctor.
Okay. And it is started on hands, and also it is progressing to your body and legs.
Yes.
And can you remember that did you get any injury or any type of abrasion or any type of friction on your hand before it started?
No, doctor. I didn't notice any.
Any exposure to certain chemicals or any abnormal things that you haven't exposed to before?
Uh, no, doctor. I haven't noticed.
When you noticed, was it in the morning or evening?
I think, doctor, around noon.
Okay. And is there any variation in time that when they are more prominent and when they go away?
Doctor, I haven't noticed that.
Okay. And with this, did you have any other problem like any fever, any rise of temperature,
No, doctor.
any sneezing or runny nose?
No,
Okay. Any pain anywhere in your joints?
no.
Any headache?
No, doctor. I haven't noticed.
Have you noticed any changes in your vision?
No, doctor.
Any changes in the eye color?
No,
Any other rash anywhere in your body?
no, doctor.
Any changes in the skin? Any skin tightening or just like that?
No,
Okay. And any changes in your appetite?
no, doctor.
Have you noticed any changes in your weight?
No, that's been all right. Quite all right, I think.
Any nighttime sweating?
Nighttime sweating, no,
Any weather preferences?
no, doctor.
Any cough?
Not cough, doctor, but I have some issues with my chest. I think I have some asthma issues. Okay.
Okay, I am coming for that later. And any shortness of breath now?
Well, doctor, not now. I think around 1 or 2 months back, also around 2 months back, I told you that I have some asthma, and I felt that my control of asthma was not very satisfactory. I had some inhalers. I were taking some inhalers, and after that, I went to the GP, and they sent me to chest medicine. Okay, and actually, they changed my medication, and they gave me some steroid inhalers. Doctor.
Okay. And do you have any racing or pacing of your heart?
No,
Any chest pain?
no,
Any lumps or bumps in your body?
no.
How about your bowel work?
It's quite good, doctor.
Have you noticed any blood or any blackish stool?
No, doctor.
How about your water work?
It's quite good.
Noticed any changes in the color, any redness?
No, no, no.
Do you have any other joint pain or any pain on your uh, uh, anywhere in your body?
No, not that I've noticed.
Any pain on the muscle?
No, doctor.
Any weakness at any side of your body?
No,
Okay. And have you noticed any changes in the color of your finger when you are exposed to cold?
no, no, no.
Okay. And can you tell me that have you noticed that anything that increases the rashes or increases the problem of your rashes?
No, doctor, I haven't noticed actually anything. It's only 3 days.
Just scratching anywhere does brings this type of rash. Have you noticed
Sorry. Can you tell me
any
again?
scratching?
No, 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 no.
Okay. And have you noticed that is there anything that uh, can help you?
No, doctor, I haven't found out anything. It's too early. I just gave some pressure and told that found out that it doesn't go away. So that's all. And I am actually a very health conscious people. I usually don't do anything out of GP's advice.
Okay, that is fine. And another thing you said that you have asthma and is your asthma under control?
Doctor, it were more or less under control. But as I told you that I for the last 2 months back, for the last 6 months actually, I noticed that there were some problems. So I visited my GP last 2 months back, and he changed my inhaler to some mixed inhaler, I think, which has some steroids in it.
Okay. And did you have any history of runny nose, fever, or any type of problem recently?
No,
Okay. And you are taking inhalers. Any other medication do you take?
I don't take any other medication, doctor. But actually, what happened that 1 month back again, my asthma control got a bit bad because I went to travel to a cold zone. Okay, of since I'm a traveler, I went to a cold zone in Russia, and at that time I had some more problem with my asthma, and actually I took that took steroid tablets. Okay, for I think for around 5 days, and after that also. I think I took that tablet for 2 or 3 times more.
Okay, that you took a steroid.
Yes, doctor.
Okay. Do you take any other over-the-counter medication?
No, doctor.
Any herbal products?
No,
Okay. Do you have any allergy to any medication or anything else?
Not that I know of, doctor.
Okay. And I am sorry to ask, but may I know that do you take any blood channel medication or any IV drugs?
No, doctor.
Any of your family member have any type of problem that you would like to share?
No, doctor. I don't know of any. But my father had diabetes. That's all.
Any of your family member have any history of cancer?
Not that I know of, doctor.
Okay, sorry. And may I ask you a few personal questions?
Yes, yes.
Do you smoke cigarette?
I've yes, doctor. Yes.
Okay. Actually, this is injurious to health, and I would recommend you stop smoking totally. And if you need help, I can refer you to the smoking cessation clinic. Is it okay for you?
Yes, it's okay, doctor. No problem.
And do you drink alcohol?
No,
May I know that? What do you do for living?
I'm a school teacher.
And is this condition affecting your daily life or your job?
I'm a bit bothered. Nothing else, doctor. I'm a bit bothered that what's going on with my skin. I'm usually a very conscious person, so I'm a bit bothered.
Okay, I can understand. And whom do you live with?
Well, I live with my husband.
And are they supporting enough?
Yes, doctor. They're quite supportive.
Okay. Do you have any history of recent travel?
No,
And may I know that do you have used any recent products, any recent certain chemicals or any beauty products or anything else recently that you didn't use before?
no, doctor.
Any history of any tick bite or any insect bite recently?
No, doctor.
Okay. Then may I know that what is your concern?
Well, doctor, what's the cause of it? What's causing these problems?
Okay. And
Well,
as
doctor, another thing I think I would like to say that I had some thyroid issues. That's all previously, but now it's well under control.
do you take any medication for that?
Doctor, I have taken thyroxine. I've been taking, but it was around I think 5 years back. I had this problem. I took thyroxine for around 2 years. Then I checked, and since then I have been quite good, and I don't have any problems, any subjective, any problems.
Okay. Have you noticed any change in your weight recently?
No, no, everything is all right, doctor. I know about those changes. Don't have any changes now.
Okay. And do you have any problem in your liver before?
Sorry,
Do you have any problem in your liver? Do you know any problem?
no, no, doctor. I don't know of any.
Any history of jaundice in the past?
No,
As far as I've taken your history, I need to examine you, then I could give you the best explanation. And at this point, I going to ask you a few personal questions. That is your period regular?
doctor, it's regular, but I think since the last period, which actually I had 15 days back. I think I had a bit more loss in my blood loss in my period.
And do you take any contraceptive pill or any pill?
Yes, doctor.
And do you have any history of loss, child loss?
No, no.
Okay, and
Well, doctor, please don't mind, but actually, it's a bit personal question. I think about the child loss.
okay, actually, well, I need to know this because I sometimes it may related to this type of condition that you are suffering from low blood. And I am sorry to ask if it
Okay.
had caused you any distress.
Mhm. Okay. Okay.
Okay. As far as I've taken your history and on your examination that your one component of your blood is less than normal, that helps to make the not to blood split out, or that helps our body to protect from excessive bleeding when we got any cut or when we got any injury. And for your case, that their amount is less, very less than normal. And apparently, I didn't find out anything abnormal with you like right now. So I have few possibilities that can happen with you. And one
Okay.
thing we called idiopathic thrombocytopenic purpura. Don't bother by this term. And in this condition, the count of that blood component is get less than normal. And for that, we need to give some injection, including steroid injection.
Okay.
Do you get me?
Yes, doctor.
And in the meantime, we need to keep you under observation. And after that, if we find, we will also do further test. And after that, if we find any other problem, we will go for their specific treatment. And in the meantime, we will take advice from the blood doctor also.
Okay.
Do you have any
Well,
question?
will I be all right, doctor? What do you think?
Actually, after getting those test results, we can give you the best explanation. And as we are thinking that you have this condition, as I have mentioned, it is almost a curable condition with taking medication.
Okay. Do I need admission, doctor?
I think you need admission and close supervision.
Okay.
Do you have any other question?
Thank you. Okay, doctor. Thank you.
Thank you.
Okay. So, what can be the diagnosis here? What do you think?
My probable diagnosis is this is a case of idiopathic thrombocytopenic purpura. My other differentials are this can be a case of uh, this can be a case of thrombotic thrombocytopenic purpura. Then this can be a case of
I think it can also be a case of steroid-induced purpura. Okay. Sometimes steroid itself can induce some purpura.
okay. Actually, forgot.
Yeah. Okay. And well, actually, there is no problem. I just told about steroid, but actually, that steroid intake was quite a few days back. Actually, it's around I think around 50, around 1 month back. So I just told it. But I'm you have been on the right track. That's no problem. And how do you think you'd like to manage the patient?
I will go for the investigations. That is routine investigations, complete blood count to see hemoglobin level and white blood cell count level, and also platelet count levels. And then I will go for the peripheral blood film. And also I will go for the inflammatory markers, ESR, CRP, then liver function test, renal function test, urine for routine examination, then random blood sugar level. And she has thyroid issues, so I'll go for the thyroid function test also. And in the meantime, I will go for some that is called auto antibodies, that is anti-nuclear antibody. Then
Yes.
uh, yeah, I forgot.
Okay. I think okay. Some antiplatelet antibodies can also be, I think,
Yes, antiplatelet.
thought of.
There are some antiplatelet antibody two types, but I forgot their name.
And GB2, GB3, 3A, 2B3.
Yeah.
Okay. And well, I do you think that it can be an autoimmune association?
Yes, this can be a case of the autoimmune.
Well, if it's so to find out, I think do you think that you might do some Coombs test here?
Yes, I also wanted to mention the Coombs test. I forgot.
Yes. If you find that Coombs test is since she has mild anemia, I think 11.5. Okay. Sorry, what I saw, I think mildly anemic. I think. So 12.5, although it's not very supportive, but still you should do Coombs test because If it's positive, then I think it's a specific disease. I think you have heard about Evans syndrome. Okay,
Yes.
so this should be ruled out. And again, you have told correctly that you should do some in profiling and other profiling. And at the same time, I think you should also do about some anti-TPO antibodies or something like that, because I told about some thyroid issues. Okay, just to be sure about it, that whether thyroid association is also present here or not as an autoimmune presentation. I think so. Okay. Hmm.
Any type of is there any blood cancer or any bone marrow disease
Yeah,
that
you should. There is a huge DD in this case of patient.
yes,
There
I
are very specific causes, and you missed another thing actually, HIV. Any rash,
yes,
HIV can be important. Okay.
yes, I
Uh,
forgot to ask.
so you asked about other things like bug bite, everything good. Dengue, you asked about a headache, a backache in the eyes and problems. So you actually asked that well. You asked about bug bites, but you missed HIV. She's a young woman, and it should have been asked. Okay,
Yes,
and this should have been asked. And again, you regarding this patient, you should have asked another thing. Just a simple question: any pain in your bones or any pain in your anterior chest? That is, we call that bone pain. Okay, okay. When we press with our thumb in that bone, there can be some severe pain. So that is actually that should have been asked separately, not joint pain only. Okay, I think you should have asked about any bone pain. In leukemia, there can be widespread bone pain. Okay. Hmm.
okay,
So that could have been asked. Lymphoma leukemia, you have asked about other. You have by systemic query, you actually ruled out other cancers. That's very good. You could have also asked about some tummy pain, because it can be HSP. Okay, to rule out just to rule out henoxonal purpura, HSP, and what about you asked all is right. You for drug cause, you actually there are some drug causes like sulfonamides, corticosteroids, okay, chloramphenicol. These things can actually precipitate purpura, and uh, also there can be some I think vasculitis purpura. I think okay. So vasculitis, you have actually asked well about systemic sclerosis and other things, but I think you should have asked about some blood transfusion, because PAN can be associated with hepatitis B. Okay,
yeah,
so uh, so polyarteritis nodosa, I think this could have been asked by asking some blood history, blood transfusion history. So actually, these are very subtle issues, but you have dealt well. You have asked about viral illnesses. You have asked about other any type of uh, infection. You have asked about malignancy. Just missed leukemia, I think, by asking that. You have ruled out infectious causes, but you should have included HIV and drug cause. That was all right, I think. And may I know that how would you like to manage the patient?
if it is a case of idiopathic thrombocytopenic purpura, then I will admit her and closely observe for, and also will go for regular platelet count to see regular platelet count level. I also actually I will involve the hematologist in this case, and
Mm,
under close supervision, she will need to start. She may need to start with
mhm,
intravenous
mhm,
steroids like
mhm,
methylprednisolone and also other
mhm,
immunosuppressive agents.
mhm. Okay. And okay, and well, I have another question to ask. That suppose that this what you tell this purpura or something, this was raised and painful, then what would you think?
Yeah, resistant penicillin, then I went for the vasculitic causes.
Yeah, that would have been very much important. Okay, that's all right. Otherwise, it's quite good. I think most of the cases have been ruled out, and I think that we can bring an end to the session. Okay.